might be the direction we head next, is to have a formal training. So this is someone who just completed a formal training. Thank you.
Hey. Thanks for having me here. I consider myself the least expert person on the panel on this topic, but that's why I'm here. So I am Sharon Batista, and I want to talk about the experience of being a new adopter for this practice and learning about it in a formal way just very recently, and maybe why I wanted to learn about it, and some ideas I have about ways that we as mental health practitioners can take this forward. About a year ago, so I'm a psychiatrist, so mental health, but different training, but a lot in common. I got involved with the American Psychosomatic Society's telemedicine, I think it's called, interest group. And I go to that meeting every year. I'm very interested in helping people with medical illnesses with their psychological complications or vice versa. And this is something that is very much in the infancy in that part of the professional world as well, but there's a very strong interest group. And I said, wow, how can I do this? And I didn't leave that meeting knowing how I could do it myself, but I just kept thinking about it. And then in the winter, I decided I wanted to make a career change. And so I started looking into, well, who is doing telemedicine that would want me to at least come work with them as a way to get into the field. And I applied for some positions. I was offered a position. I actually didn't take it because I wasn't sure it was the right position. But it got me thinking even more about, could this happen locally on a smaller scale where I am, not through an employer, not through a company. But I didn't pursue it any further until Frank's training came along. But an interesting thing happened during that time in the spring, as his life is. There was a big, huge, extreme diversion from my path. And that was that a very close colleague and mentor was diagnosed very suddenly with a terminal condition, and I had to close his practice. It was extreme. It just was. But this person was somewhat, I feel, brilliant, cavalier, inspiring, and at the cutting edge of whatever the cutting edge of anything he did ever in any part of his life. And so when I got all his charts and all his stuff, and people started calling because they were like, where the hell is my doctor? I had people from Hawaii and Maine and like all over the world calling, looking for him. And I couldn't take care of all those people. And I said, wow, there's a need here. I can't meet this need now. I mean, I called my malpractice insurance, and they did what malpractice insurances do, which is tell you that no good deed goes unpunished, and do not prescribe across straight lines, and so on and so forth, which is not relevant here. But I said, wow, if I had this training and credentialing, and maybe I could have done something more that I can't do in a sophisticated way now for these patients in need who are saying goodbye to their psychiatrist. So that got me thinking further, and then this opportunity came up to actually do a training on telemental health. And yes, the 8-hour training, it was grueling. No, it wasn't grueling. But laid out for me the framework for what ingredients you need. And I really recommend, if there's interest in this group, and I mean, hopefully there is in NYSPA, to take the next step and get that framework. Because I think the more of us that are doing it, the more it's then going to become standard of care and reimbursable, and that's really important for reaching underserved populations. So you heard about the crisis that inspired me a little bit. So I guess I'll tell you about the training and what I liked about it and what I experienced then. I have used Skype. I'm just going to out myself here. I've used Skype when I've had patients like travel, and they need me in a pinch or whatever. And it's not as good as the Cisco program that we had used in the training. The connection is not as good. But in a pinch, I've done Skype, I've done FaceTime because that's what I had previously. The experiential aspect of doing this work, now that I have a better platform and I have some better framework to prepare myself for what to expect out of it, is that I feel it's just as good as being in a room with a person, except that you can't do the same things you can do in the room with a person that would be smell them, touch them. I mean, not that you always want to smell people or touch them, but
Or should.
but it can be important, right? I mean, I've had patients come to my office and they reek of vodka. They just do. That's important information that you're not going to get on the internet. Now, is that every patient? Generally, no, it's not. You know, for a psychiatrist, sometimes we do have to examine patients physically. I can't take a blood pressure. I can't test for rigidity, cogwiggling, like in Parkinson's. So I can't do those things. But I think if we set those things aside, what you can do a very thorough assessment. You can have a close rapport with the patient, just as you would in your office. And I truly feel that way. I've done teleconferencing with colleagues and just talking about cases to practice this. And we just laughed and had a great conversation. We actually couldn't get off the phone, the non-phone phone. We just didn't want to stop. And with the patients that I have piloted this with now, they're very satisfied. I still prefer myself to mostly have my practice in person when possible, but it's a wonderful tool that lets me be open and flexible. And some of my working professional patients appreciate that because they can beam in from their office. I have executive patients who, like, getting on the train for the 15-minute train ride to my office takes away from their session because there's people calling them and interrupting them and dragging them down the hall to the next meeting. And so they can set aside more time for a telemedicine session than they could in in-person session. That's an advantage in some ways. I have a lot of dreams for the use of this. I'm a psychosomatic psychiatrist. I really believe in teamwork and collaboration, and I work on teams with psychologists, social workers, nurse practitioners, nutritionists, and other health professionals. And I think that this can be really expanded to enhance our teamwork. I think it also can help us to give consultation to patients who live in rural areas, even upstate New York, who there isn't a psychotherapist within 10 miles of them or something. And so I think that we could use this as part of our advocacy to extend, we have a wealth here in New York City, extend that to others who can't access. And so I'll get off the stage before the Oscar music plays, but just want to give you my perspective.
Thank you so much. I really wanted you guys to get the perspective.
Yeah,
What?
where exactly did the lady do the training?
Right.
And what does it actually involve?
So it involves more deeply the stuff that we went through. I did the training with Dr. Heiler, who was here earlier, Dr. Stephen Heiler, and it was co-sponsored by the New York Society for Ethical Culture, the American Psychiatric Association's New York chapter, and SAMHSA.
And how much is it?
That was a $20,000 grant. Between all the...
How much would she have to pay?
Well, if we want it for us, then we talk about that. We sit down and we plan it. If that's something that we want to do, we have to figure out what division
You'll get less than
would sponsor it. And,
I thought that on one of your slides there was a citation about a cost for the Northeastern Regional. It was like $1,500
Yeah, it was first.
Marlene.
oh, Marlene Mayhew, yeah. I did that. That's one of the things I did.
Right.
Is the Telemental Health certification, and it was probably about $1,500.
Yeah.
Is that right? Yeah. And that's a 32 credit course.
Yeah.
What we did it was 8 hours. We'll talk more about this. I want to make sure that you guys hear everything from Dr. Doyle that Dr. Doyle wants to talk about, because this is our New York State Board, and I'm so excited that she's here. Because a lot of people say, do we have anything in New York? We have an answer for that.
Actually, we have quite a lot in New York. I'm going to try and struggle to see this without my glasses. I broke my glasses and have a CVS pair. So, okay. First of all, the New York State Board of Regents are the ones who have the full authority to license, discipline, and determine practice in every profession in New York State. We now have 53 professions. The last two are applied, the two applied behavioral analysis professions, and we may have another one coming along soon. The boards for the professions are boards that assist the department, my department, and the Regents in making determinations relative to those areas. So discipline, conduct determinations of what is appropriate conduct and so on. And so what you have, what I brought with me is a bit of work that was done over a period of 2 years by the Board for Psychology, in which they looked into every aspect that they could at the time of telepractice. Telepractice has been a major issue in New York State with the Board of Regents for several decades. It started with the fax machine and the telephone, and it has gone on through a whole variety of other kinds of means of communication, video conferencing, and so on. And the Board of Regents basically have addressed it in a variety of ways. I mentioned one of them earlier to you. Another one was going back, this had to be in the 90s again, where we had a clinic on the St. Lawrence River where persons would be brought into the clinic, and there would be a conference with a psychiatric facility further toward Buffalo, where it would be determined if that person had to be brought down and admitted to the hospital. And I saw that back in the early 90s. Another thing you may not be familiar with is the fact that a lot of telepractice really came out of the military and the work that was being done in the Pacific. And physical medicine as well as psychological or psychiatric medicine. So we have had talks on telepractice. We have had rulings on it for a long time. The first ruling was made for medicine when the Board of Regents and the department determined back in the end of the 1990s that a person could only practice in New York State if they're licensed in New York State. And so if someone is going to practice with a patient in New York as a physician, they had to be licensed. Every profession has its own exemptions. So psychology has an exemption which would allow someone to practice in New York for 10 consecutive days or 15 intermittent days in one single 90-day period in a lifetime. And so a person in that instance would be able to practice in New York. But the law in New York, the rule in New York, is that you are licensed in New York if you provide services to the patients in New York. And the thing that you need to keep in mind is every state has its own rule on that. So if you have people who are traveling, if you have people who decide to live for 4 or 5 months in Maine or Louisiana or someplace, contact that state and find out whether they require you to be licensed in order to work with your patient there. I say these things because what happens is they become issues not so much of a criminal action, but of a professional discipline action. And it's really important to keep in mind that the APA, the ASPPB, NYSPA are wonderful groups. I think I was born into APA. I was a child when I began. But APA, and it has an aspirational code. It is adopted by some states. It is not adopted by New York State, or most states, as a basis for discipline. It's an ethical code. And as a member of APA or NYSPA, if you follow their ethical code, then you have to as a member. They can take an action against you. But that action may not have any meaning in New York State. The law, the rules of the Board of Regents on unprofessional conduct, and the New York State law relative to professional misconduct are the 2 sets of laws that actually determine practice and what you can be disciplined for. And so I'm going to give you a website. Go to www.op.nysed.gov. OP, Office of the Professions, .nysed.gov. When you get there, you will find everything you need to know about most of the professions. So you go over and you click on professions and click on psychology. When you get to psychology, you're going to get all of the information you need, and you'll get the practice alerts. Practice alerts like this one are written by the board and the department. Our lawyers obviously review them after they're done. And they basically are done to help you practice competently and safely and give a good standard of practice and not be charged with professional misconduct. back in 1994 or 5, the board started doing these practice alerts. We found all the charges that had been made against people, all of the complaints rather, not the charges. And we found all these complaints that were made that never went on to charges. And so the first practice alerts began to be done. Record keeping, confidentiality, couples therapy, all of those things that would help psychologists not get charged or not get a complaint, forget about getting charged. So the one on Telepractice is on that website. You go onto the op.nyscd.gov, go to professions, go to psychology. On the left-hand side, you'll see the menu, and you'll see practice alerts and guidelines. The other thing is that our website has ongoing day-by-day changes in the law, rule, and regulation for all the professions. So once you go there, you're going to be able to see what is current. In terms of, let's go back. In terms of telepractice and so on, the issues that are identified is really important. And what I heard all of you talking about today was great. I really like it. I also am someone who walks around with 3 different kinds of electrical equipment. I had the first iPad ever made, and so on. So the point is I'm very much in favor of this, but I also need to warn you that what the laws, the regulations are in New York apply to every mode of practice. Telepractice is not considered anything different than a mode of practice in New York. And every one of the laws, rules, and regs apply in the same way. So record keeping, you must maintain records as you would any other record. And keeping in mind that everything that you have is part of your record. And I'm going to divert here a little bit and say something that everyone will say, oh no, not true. But HIPAA is not the rule in New York. It is in terms of billing and things of that nature. It's a law related to insurance companies and practitioners. In New York State, the New York State law, rule, and regulation supersedes HIPAA. If you read HIPAA's law, you're going to see any state where the law, rule, and regulation supersedes it. Supersedes it means patients have greater access and more privacy. And New York State law, rule, and regulation supersedes it. Not that you don't follow HIPAA, but you have to also know what New York requires. And so confidentiality is very important. Ensuring the confidentiality of your communications. And it's the responsibility of the practitioner to do it. Encryption and all of those things are very important. Record keeping. The maintenance of a record. It is your best defense. And over the years, I have people who said, oh, I don't keep records on that. It is your best defense in a professional misconduct charge, because you can be charged with professional misconduct at any point in your life. There is no statute of limitations. Your records are your defense. We also recommend that, although our law says, our rule says, that basically you only have to maintain records from 6 years from the termination of treatment, unless you're dealing with children, persons under the age of 21. And then it's 6 years and to the age of 22, or 1 year past the 21st birthday, that you maintain the record. The point is, though, if in today's world you can scan whatever you have, that record is your best defense. And I tell you, I will say that it's more of a help to the persons in the past than not. As far as some of the things that the board and the department have talked about are activities that go on now, like social media. It's very important to keep your appropriate professional distance in social media. And also to help your patients understand the impact of what they put on social media relative to the practice. That's part of the care of the patient. Another thing is advertising. Be sure that you advertise according to the rules for advertising. Now, I could go into that in detail, but go to our website. You're going to see when you go to that psychology website, Go to the side, it will say laws, rules, and regulations. Click on rules. The rule, Part 29 is the rule of the Board of Regents on unprofessional conduct. That is the rule that you're going to follow, along with the law relative to professional misconduct. And take a look and see what it says relative to advertising. That's very important. Another thing that I heard today, and I have absolutely no idea how the arrangements are, but be very careful that you're practicing within a setting that's legally authorized to practice psychology. So that if you're in a setting, keep in mind that the setting is practicing if you are working for them. If you are not separated from them and they are offering your service, they are practicing. Be sure that they have a waiver to do it from our department, or have an operating certificate of some kind, or basically have the authority to practice psychology. Another thing would be, let me just see if I'm missing it. Oh, face-to-face, someone mentioned that. I can tell you when we permitted some people to do a month, 3 times a month rather than every month's hour of face-to-face supervision by telephone. And that's in Hamilton County, where they had 1 psychologist and working in the prison system. And so we let people in the other prisons talk with that person on the phone and then drive over the mountain once a month to meet. But Hamilton County is a very cold place in the winter, very high and cold. But anyway, those are the kinds of things that you need to be aware of. At some point, the likelihood is that we will be looking at supervision and things a little different. We're already beginning to look at it. And if people are in great need, we are not going to deny them access to a license if there is no other way to get service. But we have to ensure that whoever is supervising them knows them, is fully responsible for what they're doing, and basically is providing good supervision. I'll tell you, I went to an APA convention back in the 90s in Boston, and I spent 3 days talking about telepractice, teleeducation. And they had people, it was really fascinating, they had people all over the world who were acting as instructors, and people from one university in different hospitals were all communicating through video conferencing, and there was also translation of what was being said. It was a fascinating thing. I haven't seen us yet come to that, but I think at some point you probably will get close to it. In terms of, you have to have appropriate agreements with patients. They have to definitely be able to understand what it is you're doing, so that they have informed consent. Informed consent means real knowledge of the potential hazards and their agreement to it. And again, I'm going to go back to the corporate practice issue, because that's been a very big and complicated issue. And be sure that the corporation, the entity with which you are working, if you're employed by them or they're advertising your service, is able to practice psychology. And then I think the other thing is that if you have questions, we are always there to give you some information. Again, New York State law rules the professions, all the professions. And no matter how wonderful the codes of ethics are of the other associations, and I am very much in favor of people following the codes of ethics and belonging to groups, but be sure that it doesn't contradict what's in the New York State law. Other than that, I think, go ahead. I think it's a great thing, and I wish everybody luck in doing it. As it is, we're trying some things ourselves right now. The board is putting together a kind of a PowerPoint. They're talking to me about Prezi. I didn't know about Prezi. I'm looking into Prezi now. But they're doing a little PowerPoint that we hope to put on our website to help students, those seeking licensure, to understand what they have to do. Right now we have a step-by-step thing with links. Now we want to make this visible and someone talking over it. So.
Thank you.